Hello, hola, jambo, karibu. Today we are covering a topic about risk assessment. What risks are you predisposed to at your workplace? Many healthcare professionals of late are predisposed to risks, some of which involve their patients. Recently, there was an episode in North Carolina where a colleague of mine was involved and she had a stab injury. She was stabbed severely until she lost her life. And it kept me wondering, have we assessed the risk? Was there any risk assessment in the organization where she was working in that she got her losing her life at the place of work? Have you done your risk assessment? There are so many risks that healthcare professionals are exposed to in their workplace. Number one, there can be a risk like that one where you can be handling patients with mental health challenges. And in these situations, you need to be aware of your surroundings. It is advisable for you not to be alone in the room when you are consulting with such patients. Important for you to be two, and even the seating arrangements. Ensure that there is a door, there are two doors, one for entry, the other one for exit in case there is an emergency. It is also important for institutions which are handling mental health patients to ensure that they check the patients that are coming in, whether they are having any sharp objects, whether they are having any guns, because you will never know the state of mind of the patient even as they come to consult with the clinician. So the safety of the clinician is important. I've heard it says that the client is always right. But we also need to look at the situation this way. If this patient is sick, is their decision or are their decisions always right? How are you protecting the welfare of your staff? Ensure that you have done risk assessment. Number two, in the risk assessment, check if there are needle break injuries. Most healthcare professionals are exposed to needle prick injuries. In your institutions, do you have policies about needle prick injuries? Is there post-exposure prophylaxis, or is there post-exposure treatment or management of staff who are exposed to needle prick injuries? We will need to assess if there is such a risk and look at ways that you are going to prevent them. To include not recapping needles, to include having sharp boxes as close to the point of use as possible, to include good waste handling so that we avoid needle prick injuries. The other risk is the risk of fires or burns. Does your institution have fire policies? Does it have fire extinguishers? And most importantly, are your staff aware about use of these fire extinguishers? If they are not aware, you need to organize for trainings so that they know what to do, which fire extinguisher to use for which type of fires. Ensure that in your institution you have proper labels or posters that will show the staff fire escape points, and ensure that these fire escape points, they do not have things that are obstructing, such that in case of a fire, there is a through way for your staff to be able to escape the point of fire. If it is in a hospital, ensure that there is a proper fire evacuation policy where, like if it was for example, an operating room and there is a fire outbreak, the question you are going to ask yourself is, how do you evacuate your staff and the patients? Ensure that there are regular drills for your staff to know, and so that they are always practicing this, such that when such an incident happens, everybody is aware of what needs to be done. How about the risk of back injuries? If it is in a hospital where patients need to be transferred or lifted from one area to another, it is important for you to ensure that there are lifting devices or hoisting devices that are going to help the healthcare staff members to transfer the patients safely from one area to another. Most low back pain injuries that staff get, it is due to poor transfer mechanics. So ensure that your staff have been trained on how to transfer patients so that they protect their backs, so that they also do not become patients for doing what they love to do. If you are having obese patients that need to be moved from one area to another, there are transfer stretchers, there are hoists that can be used to transfer the patients from one area to another. So ensure your staff know this and they know how to, they are able to transfer patients safely from one place to another. Another risk that is available, that can be around, is noise pollution. How noisy is the environment around you? You may not be aware that there is noise pollution, but you might you may realize that by evening, if you are in a noisy place, you will be feeling so tired. Other than tiredness, even you will continue to have chronic hearing loss because of the constant exposure to a lot of noise. So ensure that if you are in a noisy place, that you have earplugs that will be able to protect your ears, because you may stay in that workplace for a very long time. Another injury that is very common in the workplaces is the injury of falls. You will realize that either floors are wet or they are slippery, or there can be fluids on the surface. Ensure that if you are having a slippery floor, there is postages that are showing all the people or customers or patients or staff who are using the area, so that they are all aware that the floor is slippery, and then they are avoiding running or walking very fast to avoid falls. Another thing that you can do about the slippery floor is, during cleaning, ensure that there are postages that are warning signs to alert people who are coming over that there is a wet floor. There are quite a number of things that you can do. If your staff are using computers, you need to ensure that they have been trained about eye care, so that the light that is coming from computers does not affect their eyes in the long run, because we know there is a lot of glare that comes from the computers that your staff would be using. Ensure that they are trained about this, and that periodically, after 1 hour, they are able to move from their computer, move around, and then they get back to their station to continue working. We realize that the employee's health is very important. So wherever you are, do a risk assessment. Is there a risk of chemical injury? In some places, like hospitals, you find that the nurses and the medical personnel work with chemicals. Some of them are very corrosive, and others are even carcinogenic. So find out which chemicals are you having within your environment, and are your staff aware about how these chemicals are supposed to be handled? They need to have proper PPEs, that is protective equipment, which they need to use if they are mixing these chemicals, or they ensure that they have proper masks to prevent them from inhaling the toxic fumes from the chemicals. These are some of the risks that one can be predisposed to in their workplaces. I have covered the risk of falls, risk of even being stabbed or injured by patients. Some patients even spit on nurses or other healthcare personnel. You should have a policy in your hospital that your patients are aware that much as they are being treated well, they also need to be kind to their caregivers, because we need to take care of our caregivers in order for them to give us the best of services. Thank you. See you again in the next one.